Hi, good evening everybody. So tonight's topic is hamstring tendinopathy, or more specifically proximal hamstring tendinopathy, which means the really high one. My name is Maryke. For you guys who don't know me, I'm the physiotherapist from sportsinjuryphysio.com, where you can get online physiotherapy treatment for your injuries. Now, how the lives work is if you've got any questions, pop them in the comments. Let me know if you're watching, and if you've got any questions on replay, make sure that you tag me in there so that I know you're asking them and I'll come back and answer them. Excellent. So in tonight's session, I'm going to cover the anatomy of the hamstring, explain to you why you develop hamstring tendinopathy in the first place, and then we're going to look at the different causes for it. Okay, there's some of the things you can do something about and others that's not quite under your control. And then we'll look at what different treatments helps for it and what type of things you need to be doing to get rid of it in the end. But like I said, if you've got any questions, let me know in the comments. Okay, so let me get this picture up. Oops, where is that? There we go. Make it a little bit bigger. So if we look at the hamstring, your hamstring muscle is actually four muscles or four strings of muscles that forms the full-on hamstrings, and they come together in one tendon that attaches to your sit bone. So if I can show you on me, if you think that bone where you sit, which way do I need to move to get this in there? Right in there. That's where your hamstring tendons attach. And although they're four different muscles, they come together in one tendon up there. Now, if you look at the picture, they then split into two groups. You've got your semimembranosus and tendinosus that comes down the inside of the back of the thigh and attaches on the inside of the knee. And you've got your two heads of your biceps femoris that comes down the outside of the leg and attaches on that side. What else is important? So yes, your sit bone is your ischial tuberosity is the fancy name for that. And that is literally the bones that you sit on, that's on your pelvis. So you can see the picture there. Now, if we move on to what causes the hamstring tendinopathy. So if you think of where the hamstring tendon attaches right in there, when you move your leg forwards, let me just move this out of the way. Can you see that if I lift my leg up like that, I'm going to stretch the hamstring over that bone and we're going to compress the tendon there. Now, it's excessive compression of that tendon that causes the injury. It is normal for that tendon to compress against the bone. That's not a problem, but it's when it's excessive. Now, things that can cause it to be excessive is if you sit for a very long time, or you sit for a very long time on a very hard surface, then that's more than what it can deal with. Our bodies weren't meant to be taking pressure in one area for a very long time. It's meant to move. So that can definitely cause too much pressure and an injury. Training errors is one of the main things that causes it in runners. And some of the typical training errors you see is if you increase hill running quite quickly. So if you think about it, when you do hill running, you tend to lift your legs quite high to get you up there, and it's a strong hamstring contraction. So you're going to wrap that tendon around that bone and then forcefully come down with the leg. And again, if you've built up with that and introduced hill training quite slowly and sensibly, then it's not a problem because you actually make your tendons strong enough for that. But if you suddenly jump into hill training and you do too many sessions of them one after another, then it doesn't get time to recover. And I've just remembered, there we go, there's a nice picture that shows you that concept. So if you look at that, can you see the guy on the left who's running up the hill? The angle that's formed by his hip and his pelvis versus the person who's running at the back there on the flat, how gradual that angle is. So the guy running up the hill, his tendon is going to be wrapped around that bone or his sit bone a lot more than the person running on the flat. But like I said, that's only a problem if you haven't actually trained your tendon up to cope with that. Other things that can cause trouble is sprinting. So a lot of sprint training if you're not used to it, or just not allowing enough recovery from that. Because again, if you think of sprinting, lifting those legs really high. And then, of course, also things like hurdling, because with hurdling especially, you've got the one leg out in front of you, so that's a proper stretch over that bit. Any jumping sports can bring it on as well. I think that's the main ones for training errors, really. But then to come back to this, the third thing that can cause an excessive compression force is overstretching. So the typical person I see in this category are people who like to do a lot of yoga, Pilates, or even just on their own, and they do a lot of deep hamstring stretches, holding it quite long and taking it to the extremes. You can overdo stretching, and you can actually cause yourself a hamstring tendinopathy in that area by doing that. Now, there are other conditions that can actually predispose you to this type of injury. Conditions that influences tendons specifically. So diabetes, type 2 diabetes, or just type 1 diabetes can affect tendon health. So it's really important to keep your blood sugar levels within the recommended limits of that. Inflammatory conditions like inflammatory arthritis, psoriasis, which I can nearly never say. Those conditions don't just affect your joints, they can actually cause inflammation in your tendons and other structures in the body as well. So if you have a tendinopathy that doesn't want to react and that is really, really painful and does not settle as your physio expects it to, it's worth checking that type of thing as well, and whether, especially if you've got a family history of it. Hormonal changes. So the lovely menopause. When we go through the menopause and even the period before you properly enter it, because of your hormone changes there, it can actually affect your tendon healing and how well your body recovers. Now, I've scheduled a whole live stream about how the menopause can affect runners for later next month. So keep an eye on that if you're interested in that. Very high cholesterol can cause deposits in tendons, which can cause trouble there. And then other types of medication. This is luckily not that prevalent in the UK because they tend to not prescribe them so often. But there's a type of antibiotic, I think it's fluoroquinolone, if I'm going to think off the top of my head. Can't think of the name now. If you're interested in that, message me. I know where to find it. That type of antibiotic actually weakens tendons. But as I said, in the UK, it's not commonly prescribed, and they really just keep it for cases where they really, really need it. In South Africa, we had a problem with it that a couple of GPs close to our practice used to prescribe it a lot, and we used to see especially Achilles tendons being affected by that. But that's just something to keep in the back of your mind. Now, if you've got any of these things like diabetes, inflammatory conditions, if you're in the menopause and you're struggling with tendon pain, it doesn't mean that you won't recover. It just means that it may take a little bit longer. And sometimes you have to add on extra things like anti-inflammatory medication or something, depending on what is going on, to help you along. Normal tendinopathy does not really react to anti-inflammatories, but if you've got an anti-inflammatory condition, like an arthritic type condition, it may be indicated, but that's something to discuss with your GP. Okay, so moving on to treatment. If I can get my picture up, there we go. So treatment for hamstring tendinopathy, proximal hamstring tendinopathy, is the same as for all tendinopathies really. It's relative rest and strength training. Now, before I get into the details of those, let me just explain a little bit more about the pathology. So I've spoken about Achilles tendinopathies and things in the past, and if you can remember from that, what happens when you've got a tendon injury of this type is that the trauma or the damage not really damage, it's more the injury to the tendon is causes the muscle fibers and cells to change their shape. So normally tendons have really close packed collagen fibers that's all nice and parallel and bundled together. And you remember the analogy I used for the Achilles tendon about how if you've got one piece of string and you try to break it, it's really hard. It's really easy, but if you've got 10 pieces of string parallel to each other, it's really hard to break it. Same goes for the hamstring tendon. But now, when they're injured and you've got a tendinopathy in that, those collagen fibers aren't that well arranged and they've got more space between them and they're a little bit muddled. So the tendon loses some of its strength. Now, the reason you need relative rest is because if you keep on training through it, you're going to keep on irritating it, and it's going to become more and more painful to the point where the pain stops you from training. So that's where the relative rest comes in. Relative rest means that you only rest from aggravating activities. So it doesn't mean that you've got to give everything up. It very much depends on your specific case. So what I find is if people can come and see me quite quickly after the tendon flares up, we can settle it within a couple of weeks to the point where they can start running and training again to some sort of a level. Maybe not full on, but they can definitely start back training quicker than if they neglect it for a long period of time. So with relative rest, it's not just from running, it's also from sitting. So if you think of when that tendon is inflamed and sore, it is sitting is usually quite painful because you're sitting right on that tendon, and activities where you stretch the tendon over the bone hurt. So that'll be running, especially running uphill. Usually walking is not too bad if you keep your stride short. So you'd want to pick things in that doesn't cause you too much discomfort. Now, with regards to sitting, because sitting is often the most disruptive thing for my patients because they've got to sit as part of their jobs. So you have to make sure that you try and avoid really hard surfaces for the first few months. So something that I find useful is using a very soft cushion. So ideally, I find feather pillows or feather cushions are the best. This one's not a feather one, but then also, I'm going to bring this down so you can see the seat. Now, if you think of it as sit bone is there, and when you sit on it, it's directly underneath you. You want to take the pressure off that sit bone and off the point where the tendon is. So what I find useful is instead of plonking the pillow down and sitting on the whole one, is you leave a gap at the back of it. So at the moment, the pillow is supporting underneath my thighs, but it's not actually coming underneath where the sit bone is. So the sit bone is essentially in the air. Now you do get fancy pillows with holes in it and stuff that you can get as well, but I honestly find this works really well. Tom Goom, the running physio, does an interesting thing where he takes a towel and he rolls it up, and then he actually places it inside the pillow casing to kind of do the same thing, that the pressure is there and then your sit bone is free. So experiment with that. Previously, when I had a similar type of pain there, I found the most comfortable thing for me to sit on was actually my feather jacket. Now, I did totally ruin my jacket in the process, but it eventually helped my injury. So when you think of relative rest for sitting, it's definitely how hard the surface is. It's for what period of time you're sitting. So do you need to maybe sit for 15 minutes, stand for 15 minutes, sit for 15 minutes, stand for 15 minutes? As it gets better, you need to make your sitting longer because you can't stand for the rest of your life. That's not a life either. And actually, that tendon needs to get used to sitting again. But you've got to be gradual with how you build that up. Relative rest with regards to sporting activities. Definitely cut out hill running and sprint training where you've got to really force, and hurdling where you've got to force that tendon to work forcefully in the beginning stages of your recovery. You may be able to get away with slow jogging and keeping your stride short and light, but that will all depend on your specific case of tendinopathy. And there may be other cues depending on how you run. Like for instance, if you lean quite far forwards when you're running slightly more upright will take that strain off that tendon again. So there's a lot of things that can be played with, and it's really worth seeing a physio because they need to check what you're actually doing and then change that for you. Now, strength training, why is that needed? Why can't you just rest? So remember, that tendon has changed inside. The collagen fibers aren't lying as straight as they should. They're a little bit muddled. You've got different types of cells in there. You've got little blood vessels growing in. And all of that has to change. Now, the body only changes tissue in reaction to certain stimulus. And in the case of tendons, It's strength training that tells the body that we need to change the structure. Now, you can't just jump in with heavy strength training because you will just make it worse. And you're welcome to try because you'll know very quickly. It's got to be a graded strength training program in two ways. One, that it shouldn't be very heavy weights at the beginning. And two, that it shouldn't be exercises that stretches the tendon over the bone too much. So let me give you an example of this. For instance, let me just make more space here. If you think of a deadlift position, can you see if I'm in that position, I'm getting a large hip flexion angle, and I'm going to be pulling that hamstring tendon tight over that bone. So that's going to, if I do that with weight as well, I'm putting quite a large compression force over that tendon. And especially in the beginning stages where it's really, really painful, it is not going to cope with that. So we're looking for exercises that keeps the hip slightly straighter and works the tendon in that position, because then it's not really that compressed. We're just getting the muscle to work. So an example of an exercise that works for that is if you think of the glute bridge. So let me see if I can get myself on here. So for those of you who don't know, the glute bridge is literally just when you come up into this position. And you can see that the glutes and the hamstring is working, but we're not getting a compression force because my hip is straight. And if you wanted to make that more hamstring dominant, you would just straighten your legs out slightly. It is basically impossible to show you all the variations of all the exercises you need or you can do. And I can tell you what, that I love treating Achilles tendinopathies because they're very predictable, and they're quite easy to figure out what somebody has to do, because you only have a choice of literally one movement that you use with variations. With the hamstring tendinopathies, they can be quite temperamental, and it takes a bit of playing around to find the exercise sets that works for each patient. But in general, you start with exercises that does not cause increased hip flexion. So straighter hips like the glute bridge, or if you think of in the gym, if you're doing a leg curl where you're lying on your front doing a hamstring curl, not a hamstring curl where you're sitting upright doing that, because then the hip is flexed again. And if it's a really, really painful tendon, they tend to, it works best if you do isometric contractions. So not going up and down with heavy weights. You actually just go up and hold the resistance position for anything between 30 to 45 seconds. And you repeat that a few times. And often that can be nearly immediate pain relief for a period of time. Now, once the tendon has calmed down a little bit more, you can then start doing more strength training based stuff. There is no recipe of do this for so many weeks or so many weeks. You've got to basically test the tendon and see what it can cope with, and decide on the exercises according to that. It is okay to have some discomfort when you do your training. So they say in the research up to 3 out of 10. Now what I find with my patients is that's nearly too much for a hamstring tendon. I tend to say it's okay to think you feel something, that you can feel a bit of a discomfort, but if you start classing it as pain, then it's probably too much. And especially you want to look at the 24-hour response. So a lot of the time a tendon will not hurt while you're doing it. It will be tomorrow morning that you wake up and you go, oh, this is now stiff. And then that discomfort will last longer. If that happens, then the session you did yesterday was too much for it. So it's okay to be a bit uncomfortable, but it's got to settle within 24 hours. The other important thing is to don't blame the exercises if you've actually done something else in the day that could have annoyed it. So, for example, driving long distances, classic, where you've got to sit with it in that flexed, compressed position and your leg is straight out in front of you. So that can really aggravate it. So take note of everything you do in the day to figure out what is the best thing to do. And then the other thing is, as soon as you start doing proper strength training with weights, remember it needs recovery time. So it shouldn't be done every day. It needs to be done every second day. The lower load exercises can be done every day, but it all depends on your specific case. Then the last thing is, please don't stretch your hamstrings. I know they may feel tight when you've got that condition, but 9 times out of 10, stretching the hamstring, because it then compresses that tendon over the bone, will just make it feel worse. Okay, so I think that wraps it up. So the main thing is, this type of injury is basically a compression injury, and it can either be through excessive sitting or sitting on very hard surfaces, or it can be training error, that you up the hill training or speed training or hurdling, something like that too quickly. Or what's the last one? I've forgotten that. Oh yes, overstretching, that you've really stretched the hamstrings too much, and that's caused the injury. Yeah, so let me know if you've got any questions. Remember, if you need any help with this, I can do online consultations via Skype or WhatsApp, whatever video app you like. And what we do in a session is I would make you do all the test movements so we can see what your tendon can sustain, and we'll go through your training program that you're doing at the moment, and then I'll work out a program that actually works for you. And as you implement it, I get people to feed back, because often we need to tweak it a little bit as well. So let me know if you need help with anything. I've put a link to my website in the comments. Take care. Thank you for watching. If you would like to learn more about preventing sports injuries, make sure you hit the subscribe button. See you next time.